Hi, I'm Kathy Newman, Program Director for the Trinity Mother Frances Spine Center. I'll be following you throughout your stay here at the hospital, and I'll be happy to answer any questions you may have. Now that you've decided to have spine surgery, we would like to tell you more about your upcoming journey. Many of our patients tell us that it was a decision that changed their lives. As you approach the day of surgery, you probably have mixed emotions. Patients are often nervous about the procedure and the journey ahead. That's completely normal and to be expected. The experts at the Trinity Mother Frances Spine Center have carefully planned your care to help ensure a speedy and successful recovery. Rest assured, you're in excellent hands every step of the way. Your surgery and recovery requires a team effort. At the Trinity Mother Frances Spine Center, each one of our team members is specially trained to help you through the process. During your visits to the hospital before surgery and while you're here recovering, you will have encountered different members of the team, including your spine surgeon, hospitalist, nurses, therapist, and discharge planner. In addition, you will have chosen your coach. Your coach is a person you designate to help you prepare for and recover from your spine procedure. This can be a spouse, friend, or family member who will provide you support and encouragement. The spine is made up of bones called vertebrae. These bones are separated by discs, which allow the spine to bend. The spinal cord threads through the center of each vertebrae, carrying messages from the brain to the rest of the body. Spinal nerves exit out the spaces between each vertebrae. The vertebrae are divided by region. The top 7 vertebrae make up your neck and are called the cervical spine. The next 12 vertebrae in your mid-back are called the thoracic spine, and the 5 vertebrae in your low back are called the lumbar spine. Back pain is associated with ruptured or herniated disc, stenosis, poor alignment, spurs, and fractures. Understanding the cause of your back pain is the key to proper treatment. A ruptured disc, also called a herniated disc, is associated with leg or arm pain. When a patient has a herniated disc, displaced disc material puts pressure on the spinal nerves that exit between the vertebrae. Spinal stenosis causes weakness, pain, cramping of the legs, and numbness and tingling in the aging population. As we age, the spinal canal can become constricted or narrowed. If the spinal canal becomes too tight, back pain can be the result. Pain can also occur when vertebrae become unstable and begin to slip out of line. The formation of bone spurs or extra bone growth can cause spinal nerves to be compressed or squeezed, causing pain. Back pain from osteoporosis is most commonly related to compression fractures of the vertebrae. Osteoporosis causes weak bones and can lead to these fractures. Spine surgery can be performed to reduce instability, relieve nerve compression, and repair fractures. Several types of spine surgery can be performed. Please refer to the section on the main menu of the DVD labeled Conditions and Procedures to watch a short video that explains your condition and procedure. Before your scheduled date of surgery, your surgeon may order a complete medical examination by a physician. This physician will clear you for surgery by checking for any medical problems that put you at higher risk during or after a spine procedure. Generally, the appointment will consist of a complete medical and family history and physical exam. Tests may consist of x-rays, blood testing, urine testing, and a test of your heart function called an electrocardiogram. Your results will be shared with your physician and surgeon for their review. If any of the tests reveal significant risk factors, you may need to undergo additional testing. Any abnormal results will be shared with you. You will be instructed on medication to stop prior to surgery and to have nothing to eat or drink after midnight on the day before surgery. You should prepare your home for a safe recovery before you have your surgery. You should practice getting in and out of the car without twisting or pulling. You should make sure that all walkways are safe and unobstructed. Pets can increase the risk of falls and should be watched carefully as you enter and exit your home. Careful consideration of the safety of your tub or shower is necessary. Handrails and non-slip mats may need to be added. Your favorite chair may need some pillows added to ensure correct posture, and you should be able to elevate your feet when sitting. Frequently used items should be at counter heights to decrease the need for bending, lifting, and twisting. All Spine Center patient rooms are private, with couches that extend into beds for family members. Linens are provided for the family. There are no visiting hour restrictions or age limitations. We do ask that all visitors be well with no symptoms of illness. You can expect daily visits by your surgeon and hospitalist to ensure that your recovery is progressing according to plan. You will also have daily physical or occupational therapy sessions beginning on the day of surgery, unless ordered otherwise by your doctor. The therapist will assist you with walking and getting up to the chair. You'll be able to wear your own clothes. Loose-fitting, comfortable clothes are recommended. You'll have restrictions on bending, lifting, and twisting for about 6 to 8 weeks following surgery. Your surgeon will modify the restrictions as you go for your follow-up visits. You will be wearing TED hose and have SCDs or AVIs following surgery. These devices are used to reduce the risk of developing a blood clot in your legs. You may have a bladder catheter to collect urine. This will be removed the first morning after surgery unless your doctor orders otherwise. You will have a monitor on your finger that measures the amount of oxygen in your blood. We will discontinue the monitor when the IV pain medications are discontinued. You may have a drain at the base of your incision. The drain will be discontinued when ordered by the physician, usually the first or second day following surgery. Sometimes patients experience chest congestion after surgery. You will be given a device called an incentive spirometer. Your spirometer helps you fully expand your lungs and keeps them active, as if you were performing your daily activities at home. A respiratory therapist will instruct you on how to use the incentive spirometer and advise you to use it 10 times every hour while you are awake. You will need to continue to use the incentive spirometer until you resume your normal level of activity. Instructions for using the incentive spirometer are also in your spine surgery patient guidebook. Using safe body movement techniques during all activities is perhaps the most important factor in a speedy recovery and determining long-term success of your spine surgery. Your surgeon and therapist will say no bending, lifting, twisting, or pulling. They will sometimes use the phrase, no BLTs with pickles, to help you remember your back safety precautions. Of course, you can have a bacon, lettuce, and tomato sandwich with pickles, but no bending, lifting, twisting, or pulling. You can bend your knees, but not your waist, and you should not lift more than 5 to 10 pounds. A gallon of milk weighs 8.5 pounds, so if it weighs more than a gallon of milk, you should not lift it. You should not twist your back after lumbar or low back surgery, and you should not twist your neck after cervical or neck surgery. Proper posture while sitting will also help relieve stress on the neck and back. The proper technique for getting in and out of the bed is called the log roll. This technique keeps the back in proper alignment and avoids twisting the spine. To do the log roll, while lying on your back, bend your knees. Roll onto your side, keeping your shoulder and hips together as a unit, or a log as you roll. Keeping your hands in front of you, slowly raise your body as you lower your legs to the floor. Walk, walk, walk. The most important exercise following spine surgery is walking. Short walks several times a day is best. Your safety is very important to us. You are at high risk of falling after back surgery. Please call for assistance when getting in or out of the bed or chair. You will have a stop sign on your bathroom door to remind you to call for help. Please let us help you. Your surgeon may order a brace if you had back surgery or a collar following neck surgery. A trained technician will measure and fit you with the proper device. You will be instructed during your hospital stay on how to put the brace or collar on and take it off, and when you should wear it. You may be required to wear the brace or collar for up to 3 months following surgery. If your doctor ordered a neck collar, you should have enough room to slide one finger between you and the collar. Watch out for reddened areas under the braces or collars and have the technician adjust the brace if needed. Please follow your surgeon's instructions carefully. Spine surgery incisions are often left open to air with no dressing covering them. The wound should be kept clean and dry. Daily showers with the shower head directed away from the incision are the best way to keep the incision clean. Soap and shampoo can be used and can rinse across the incision, but with no scrubbing. Pat the incision dry with no rubbing following your shower. Do not apply lotions or antibacterial ointments unless directed to do so by your physician. Steri-strips may have been used to help close the wound. They will fall off on their own or can be removed at the doctor's office in about 2 weeks. No tub baths, hot tubs, or swimming for about 2 months or until your incision is completely healed. Communication is an important part of helping us manage your pain. We encourage you to share information with your nurses about any pain you experience. Be as specific as possible. Where is the pain? How often do you feel pain? What does the pain feel like? Is it sharp or dull, aching, or does it spread out? On a scale of 0 to 10, where 10 is the worst pain imaginable, how would you rate your pain? Is there anything that makes the pain go away? Our goal is to manage your pain so that it is tolerable. You should be able to get out of the bed and walk without intolerable pain. We will use IV pain medications until you are eating and drinking, and then switch to oral narcotic pain medications. After discharge, we encourage you to switch from the narcotic pain pills to Tylenol or acetaminophen as soon as possible. You must remember that the maximum dose of Tylenol is 4,000 milligrams a day. That's the equivalent of 12 regular strength or 8 extra strength pills a day. Most prescription pain pills contain some Tylenol. Be sure to include that in your 4,000 milligram a day limit if you're taking some prescription pills along with the Tylenol. Following spine surgery, no anti-inflammatories should be taken for the first 2 weeks, and if you had a fusion, you should not take anti-inflammatories for the first 2 months. Anti-inflammatories include Aleve, Advil, arthritis medications such as Celebrex, and many more. Please check with your physician before taking any medications. Your doctor may prescribe a cryocuff to help relieve pain and swelling at the incision site. The jug is filled with ice and water, and the cuff is attached to the jug for filling. The cold water flows into the cuff as it is lowered below the level of the jug. When filling is complete, disconnect the cuff and place it on the incision. Most doctors advise patients to wear the cuff rotating for 20 minutes on, then 20 minutes off. When the cuff is no longer cold, drain the water back into the jug by elevating the cuff above the jug. Swish the water around until it becomes cold again and refill by lowering the cuff below the jug. If you had neck surgery, you may experience a sore throat and difficulty swallowing for several days or even weeks. Broths, soft foods, and crushed peels may be helpful to decrease the discomfort associated with swallowing. You should never have to struggle to breathe following surgery. Notify your nurse or the surgeon's office if you have difficulty breathing at any time. While you are recovering at home, take several short walks a day. Keep your incision clean and dry. Report any fever over 101 degrees and any progressive swelling, drainage, redness, warmth, or increased pain at the incision site. Any of these symptoms could be a sign of an infection. If you experience leg pain or swelling and sudden shortness of breath, you may have developed a blood clot. Please report this to your physician immediately. If you get a headache when you are upright and you have a clear, watery drainage from your incision, you may have a spinal fluid leak. Please let your surgeon know about this. If you have leg weakness or difficulty passing your urine, you should report it. If you do not have a bowel movement for several days and you're experiencing abdominal pain, please contact your surgeon's office. If you are currently smoking or using other tobacco products and you're having a fusion, it's best for you to quit entirely, not just cut back. Any source of nicotine is harmful to fusion, including patches, gum, and a nicotine inhaler. The use of tobacco and nicotine products decreases blood circulation, leads to poor bone health, and slows bone healing. Spinal fusion requires that the body build calcium bridges between the bones being fused. The presence of nicotine increases your chance for infection, a failed fusion, and other complications. We look forward to sharing your journey to healing. If you have any questions, please contact your surgeon's office or call me at 903-531-5725. And thanks again for choosing Trinity Mother Frances Spine Center.